We at LAPO are committed to poverty eradication. We equally believe that the battle against poverty requires the effort of everyone.
Good morning, viewers. It's a lovely day today, and you are on to Bridging the Gap, a program which is produced by Lift Above Poverty Organization LAPO. My name is Patience Naugumwana, and I want to say thank you for taking our time to watch this program. Bridging the Gap today, we are going to be looking at the World Breastfeeding Week. You know, one of our main focus in LAPO, one of our program focus in LAPO is on maternal and child health. So today we are going to be talking about the World Breastfeeding Week, which is annually celebrated within the first week in August. And today we'll be looking at the importance of breastfeeding to an infant's health and survival. And I have with me right here in the studio, I have Professor Mrs. Sado. Prof, you are welcome to the program.
Thank you. Good morning, viewers.
Yes, Prof is from the Institute of Child Health, University of Benin, and also the Department of Child Health, University of Benin Teaching Hospital. And so with her, we are going to be talking about this very, very important issue of breastfeeding. Prof, let's start our discussion by knowing what exactly is the theme for this year's World Breastfeeding Week and also the significance of the theme.
Okay, the World Breastfeeding Week is a week in August, 1st to 7th of August, that is set aside to create awareness about breastfeeding. So for this year, the theme is Step Up for Breastfeeding, Educate and Support. So if you look at breast milk for the infant, it is all sufficient. So it achieves food security for the infant. And if we look at it from a nutritional point of view, it contains all the nutrients that are needed for optimal growth of the infant.
All right, let's look at according to the World Health Organization, exclusive breastfeeding is recommended for babies from birth. Let's look at this exclusive breastfeeding. What is exclusive breastfeeding?
So when we say exclusive breastfeeding, we mean that the mother should feed the baby breast milk and nothing else except medically indicated. So if the baby is ill, the baby can take his drugs. Otherwise, the only thing that should go into the baby's mouth is, as by way of food, should be breast milk. And this should be done for the first 6 months of life. This is because the breast milk contains every nutrient that is needed for that baby.
I want us to first look at exclusive breastfeeding now, the benefits of exclusive breastfeeding.
So when you breastfeed exclusively,
yes,
for the baby,
yes,
all these benefits I have said accrue to different categories of people. So for the baby, is the optimal food. When a baby is on breast milk, starting with the very first day that the baby breastfeeds, there's the type of milk that comes out from the breast. It is yellowish and very small quantity, contains a lot of antibodies. So we say that is the baby's first immunization. Antibodies are substances in the body that help to fight disease. So it's contained in the breast milk. So when the mother delivers this to the baby, we take it as the baby's first immunization. Then in terms of what the baby actually needs, you know, God created different animals, and for each animal he developed a way that animal will get nourishment. So if you study the biochemistry and everything about the breast milk is perfect for the baby. So that's one. Two, babies who are breastfed are more intelligent. They have 3 points higher on intelligence quotient test compared to those who were not breastfed. Babies who are breastfed, they have good emotional health. Why is that so? When a mother is breastfeeding, watch the next time you see a mother and a mother-infant pair breastfeeding. The baby is looking at the mother is looking at the baby, the mother smiles at the baby, she smiles back. There's that interaction that is going on between the two of them, and that improves bonding, improves trust, so that baby is secure, and that helps the baby in the psychological well-being. Now, babies who are breastfed also have reduced amount of allergies. You see that when you introduce these infant products, the babies may react, develop some allergies. So, but when they are on breast milk, those allergies are not there. So these are some of the these are the benefits to the baby. Now, to the mother, when you breastfeed, it helps you to maintain your shape. So you don't act the weight that you put on during pregnancy, you lose it when you are breastfeeding. So that weight, it helps you to get back your shape. If when you are breastfeeding, especially those first few days, you put the baby to breast, your body releases oxytocin. It's one of the hormones that is necessary for breastfeeding. It also affects the uterus. It helps the uterus to involute. What does it mean? Means helping the uterus to get back to its normal size. What is the uterus? That is the womb. So when it does that, you will feel a bit of pain as a woman who is breastfeeding, and that means that the uterus is contracting. And sometimes for the women, you feel blood come out. If that blood stays back there, it can cause infection. So it helps to do that. Then for the mother also, it prevents breast cancer, prevents ovarian cancer. Women who breastfed their babies have been shown to be less likely to develop these two cancers. Finally, for the mother, when you breastfeed your baby exclusively, then you have what we call lactational amenorrhea. So you don't see your period for the period that you are doing exclusive breastfeeding. And for some women, even until they stop breastfeeding, they won't even see their period. And this helps as a way, as a means of family planning. So these are some of the benefits to the mother.
Thank you so much. We are going to take a break now. While we bring you the Faces of Lapo segment, please stay tuned.
My name is Akaele Netunde Comfort. I dey sell wood for Rita Obele Estate, no block. If I want to sell, I no dey get money to sell my wood. So I join Lapo. I'm happy. I don build my house for Lapo because na Lapo help me. I like Lapo well. So if I borrow money for Lapo, I will use to buy market. I dey sell my market well. My market grow. So I like Lapo. I don build my house, my house, not my husband house, so my house. Our CEO know my house. So I like Lapo. One of my my children now, they learn tailor. Now Lapo put one of my children for tailor. One of my junior sister, she's a graduate. They don't have work. Now Lapo put her for tailor. They don't graduate now. They don't do her own sewing now. For free, no money. They do it. They pay money for her gun, Papa, for every month. They pay money for her. At the end, they learning freely. And they advise everybody to join Lapo. Lapo is good. So it's fine. Well. I like Lapo. Lapo yìí ti gbogbo wa ni. Kó má gbọ́dọ̀ bàjẹ́. Torí kò sí ibòmíràn tí a lè lọ. Àjò lè dàbí ilé. Ẹ jẹ́ ká sowọ́pọ̀ ká fìmọ̀ ṣọ̀kan. Gbé kí n gbé. Me that Lapo is not, I don't want you to fall. So let everybody to carry it up. So to do it very good.
Welcome back from Faces of Lapo. I'm sure you've enjoyed the Faces of Lapo segment of this program. And if you're interested in partnering with Lapo Microfinance Bank, you can please call the numbers on the screen. And before we went on break, we've been talking about the World Breastfeeding Week, looking at the importance of breastfeeding to an infant's health and survival. And we still have Professor Mrs. Sadu. You've talked about the role of the family members and the challenge of the workplace. What's the solution now? Let's look at the way forward.
I didn't expatiate on the role of the man.
Yeah.
You ask me, what would a man be doing to support breastfeeding? So, say kind words to your wife. Pat her on the back as she's breastfeeding the baby. And then when the baby is done breastfeeding, you can take the baby, rub the back of the baby to bop the baby, and then everyone has a good night rest. You find out that some men just back out of the room and say,
you and your baby.
But you and her brought that baby to life. So, and the waking up at night can be a lot.
Yes, it's challenging. It's challenging
for the woman. So, what they can do, mother finishes breastfeeding, hands the baby to the father, who bobs the baby. Mother can quickly go to sleep, and once father is done doing that, baby will sleep, and then everybody can get a good night rest. But what essentially happens is that some of the women, because it's night, you just want to feed the baby. Okay, you feed, and then when they feed, they don't bob the baby, and that gas that the baby has swallowed while breastfeeding goes down the baby's gastrointestinal tract. That makes the baby to twist and starts crying, and then nobody can sleep. Mother cannot sleep, husband cannot sleep, and everybody is cranky. So husband can actually support in that way. And now we are tending towards more nuclear family, so your mother-in-law may not be there to do omugo for you. So husband can help with the other children, bath them, get them ready for school, help with chores, can sweep the house, he can go to the market for her. So these are ways in which the husband can support the wife. What about the larger community?
Yes.
I've seen places where a woman is standing and trying to breastfeed at the same time, but there are people seated. Nobody will say, madam, please come and sit down. So those are things that people can do. You see a woman with a child, give up your seat for her to sit. In queues, whoever is supposed to be attending to that queue can prioritize women who have young infants with them, so that they can go and do whatever chores they have to do. So those are ways in which society can help.
So what are your final words now?
So my final words to everybody is that breastfeeding is a wonderful way to feed the human infant. It is God ordained, and I think that we should go back and encourage every young mother who has a baby to breastfeed, and not just breastfeed, but do it the optimal way, which is exclusive breastfeeding for the first 6 months of life, and then introduction of complementary feeds at 6 months, and continued breastfeeding for up to 2 years and beyond.
All right. Thank you very much, Prof, for this detailed discussion on breastfeeding. We really appreciate your coming on the program today.
Thank you very much.
Yeah. We've been talking about the importance of breastfeeding to an infant's health and survival, and we have Professor Mrs. Sado from the Institute of Child Health, University of Benin, and the Department of Child Health, University of Benin Teaching Hospital. She has been telling us all we need to know about the benefits of breastfeeding to a baby, and also to the family, the mother, the society at large. And I want to round it up by saying that it is very, very important for us to breastfeed our babies. I want to encourage mothers and especially our new moms to practice exclusive breastfeeding, because it is safe, it is healthy, and it also helps to prevent diseases and helps to reduce newborn mortality. that's where we'll end the program for today. And if you want to reach out to us, you can do that on social media, or you can call the numbers on the screen, or you can equally visit any of our offices or our head office at number 18 Johnson Road, Benin City. And don't forget that this program is brought to you by Lift Above Poverty Organization, LAPO. Till we come your way again, it's bye for now.